hold your hat. In 2014 and into early 15, health insurance premiums are going to soar. Those under Obamacare and those not under Obamacare alike are going to go up maybe by 40, 50, 60%. Some will double, and in some cases they'll actually triple. That's what I'd like to talk about today. Like it's a tough word. The good news is that it'll be a political fiasco for Obama. As he's trying to persuade the country to let him continue to run the Congress, people are going to be getting these renewal notices and getting gigantic increases in the premiums. The reason for the increase in premiums is, first of all, that few young people have signed up for Obamacare, and therefore the risk pools are much more costly than the insurers thought when they originally made their estimates. Secondly, the federal government has cut the subsidy to insurance companies, so they don't have that subsidy anymore. Also, the insurance companies lowballed the premium estimates when Obamacare started because they wanted to sign people up, and now they're having to raise them to more realistic levels. For those outside of Obamacare, in employer-based coverage, the increases are going to be enormous, and they're going to be driven by a different set of factors, all of which also stem from the Affordable Care Act that made health care unaffordable in this country. One is that it now has to cover all pre-existing conditions. You can't discriminate, and you have to accept all comers, and you can't drop anyone or raise their rates when they're sick. Those are all good changes and need to be preserved. But they drive up your insurance rates, and that's fine. The principle of insurance involves those, and it's okay. But then there are other factors in affordable care that are driving those premiums sky high. One is that you have to cover everything. You have to cover mammograms for men. You have to cover birth control for people in their 60s. You have to cover substance abuse for people who are not at all abusers. There are all kinds of requirements like that burden it with so many special interests, each getting their specialty and their piece of the pie covered. Mental illness treated on the same level as physical illness. Well, that sounds good as a slogan, but man, does it drive up the costs. And then there are features in the regulation of health care that also are driving up the costs. The big one is that you can't skew policies based on the age of the person getting it by more than 3 to 1. It costs 5 times as much to insure someone who's 60 as somebody who's 20. But you're only allowed to charge them 3 times as much. So that drives up the premiums for the younger people, because their premiums have to be no less than a third of the premiums of the older people, even though the cost of treating them are only a fifth as much. And there are all kinds of regulations within Obamacare that are driving these costs higher. So if you think your premiums have gone up by a lot, you ain't seen nothing yet. Thanks.